I could hardly walk to my mailbox and back. Lots of times I would have to stop and rest before I got back to my gates to go inside. I was constantly in the hospital because my heart rate would go so high. I was so short of breath. My gardening was my favorite thing to do, and I could not do that. And my cardiologist in Dothan told me that I had a leaky heart valve and that it had to be taken care of. He referred me to Dr. Ahmed.
Miss Summerford, she had a leaky mitral valve. When someone has a leaky mitral valve, instead of all going forward to the body, that blood is now able to go backwards, back to the top chamber of the heart. That's where you get fatigue and tiredness. That's because the blood that your body requires is not going forward. We saw just how leaky that valve was. An open heart operation would have been traumatic, and we were worried about her outcome after that. And that's when we sat down and thought, this is what the minimally invasive procedure is designed for. We did the procedure, and the valve was fixed. But not only that, that next morning she was up and about, and she went home the next day, walking around, and almost had her entire quality of life restored.
The next day I drove myself to church after I did another errand and sang in the choir. I've been able to do almost anything since.
With this minimally invasive method, where we were able to fully fix the valve, get rid of the symptoms, and send her home the next morning, we were able to achieve what I think is in her best interests.
I just cannot say enough good things about Princeton and the people here. Barry, who has done 4 echoes on me, hugged my neck when I got here this morning, and it's just been that way with all of them. It's just personal. It's been a wonderful experience. It really, really has.